mind, Rome, for patients between the age of 50 to 80. We don't want to be testing a general population of college kids because, so few of them are getting cancer. But as you know, as you enter your 50s, your chances of cancer starts to go up. So these tests are really aimed at that patient group, the 50 to 80-year-old, no prior history of cancer, who does physical annual workups. Could this be part of your annual workup? The way I explain it to some patients is, can you get checked for your cholesterol or your lipids? Could you start to think about a blood test to detect cancer when you start entering your 50s? The tests aren't perfect because they're only we're starting on this new era. The sensitivity is how sensitive is the test to pick up the cancer, and the specificity is if the test tells you there's cancer, how true is that? That's really what we're looking at. But these tests are additive because we don't have anything for, as I said, ovarian, pancreas, stomach, etc., etc. Let's consider exploring these additional blood tests on top of the current screening modalities. We don't want anyone who would ultimately be also due their colonoscopy not to take their colonoscopy because they've had one of these blood tests. So that's where I hope this will go. The tests will get better over time. There's no question that the science will evolve. The ability of the test to detect small, less invasive cancers will get better. Right now, it's able to pick up those bigger ones. What we're really doing is we're looking at circulating tumor DNA. And you might say, well, what's that? The way I describe it is when you brush your hair, some of your hair comes out on your comb, or if you get a bad sunburn, some of your skin starts coming off. Think about it like that, but on the inside of your body, tiny little pieces of the cancer, if it's there, are shedding off into the bloodstream. And we now have the ability to detect those little particles that are shedding off into the bloodstream. The cancer's not breaking up. It's just tiny little pieces are coming off, like brushing your hair with a comb. We can now detect them. We can detect them in patients who maybe not have any symptoms. So they get a blood test as part of an annual workup. If it's positive on one of the tests, we follow that up with a CAT scan to see if we can identify if there's a tumor there. So I think this is where this is beginning to move. This is what I call this new era of cancer detection, where it's circulating biomarkers. For your listenership, circulating biomarkers are things circulating in our bloodstream, but they may be detectable in other bodily fluids in the next couple of years.